Thanks for being here, everyone. My name's Liz Fraser. I'm a GP from Canberra, and this is my friend Nicole Nelson, who's also a GP who used to be in Canberra, and she's now on the Sunshine Coast. Now, Nicole is a GP with a background undergraduate degree in pharmacy, and this has given her a strong appreciation of biochemistry and pharmacology. Now, she's been working as a GP for about 15 years, and for many of those years she's had a focus on nutritional medicine, and she's currently in very high demand on the Sunshine Coast for her nutritional medicine skills. And she's also a lecturer for ACNEM, the Australian College of Nutritional and Environmental Medicine. She has a strong interest in examining the evidence base for complementary medicine and lifestyle, and the title of this talk is the use of nutraceuticals in metabolic syndrome. So today I'm going to interview Nicole, and we'll talk about some things which some people might consider controversial. And the first thing I'm going to ask is, many people say or would argue that nobody needs supplements like nutraceuticals, vitamins, and by this I mean vitamins, minerals, herbs, and other supplements. You should be able to get everything you need from your diet. What do you reckon about that, Nicole?
Well, I actually strongly disagree with that. There are many factors that can mean that you may not, even if you have an adequate diet, that may mean that you need more nutraceuticals than what's provided in your diet. So, for example, we know that there are gene polymorphisms, which mean that you have extra requirements. There can be certain disease states which rob your body of certain nutrients faster than other people without those disease states. We know that with age that some of these deficiencies happen, which can be a function of input, and so in terms of people not necessarily having adequate nutrition in general, that can be things like low socioeconomic status, the ageing population, people with increased demand, for example pregnancy, growth in children, athletes, that kind of thing. But there's also the issue of what the farmers aren't getting paid to put these nutraceuticals or nutrients back into the soil. So they do a certain amount of soil health to grow the plants, but we might be having a broccoli now that is far more deficient in minerals and nutrients than a broccoli was, 100 years ago. So there's many factors. So I cannot stress the importance of the need for these nutraceuticals above and beyond your diet. You can't necessarily get enough. And if you were trying to do that, like I do have some patients, for example, omega-3 fatty acids, they eat a lot of sardines and oily fish, but not everyone's getting that amount of things that they need in their diet. You almost have to be a dietitian to do it. So I definitely think there is a role for supplementation.
Yeah. So it's really common to see headlines in newspapers citing another study saying vitamins and minerals and nutraceuticals are a waste of time. And there was something in the BMJ a few years ago, in their Food for Thought article, and it said little evidence that vitamins and minerals or dietary supplements protect against non-communicable diseases in healthy people. And this translates into popular headlines: the multivitamin is a waste of time. But actually, when you dig down into that, who's healthy is, how many people in our population are actually really truly healthy? How many are eating good quality food grown in mineral-rich soils?
And also, what are the reference ranges for the amount? What are they based on? Are they based on thriving, healthy people, or are they based on a statistical group of people who present for blood tests who are usually presenting because they're not healthy?
Yep. So moving on, we're going to focus on the role of supplements and nutraceuticals for metabolic syndrome in people with type 2, particularly type 2 diabetes. You're already working with people to improve their diets. Like, we're not saying eat anything you like. We're saying do the best you can with your diet.
Absolutely.
Where do you go from there, and what are some of the supplements that may help?
Yeah, so it's very hard. It's like choosing which children you'd like to talk about, but there's quite a few. So there's a lot of minerals. Probably my favourites are chromium, magnesium, inositol, cinnamon, Caffeine is another one. So I actually have a list of supplements that you'll see when the slide appears up, but they're probably my favourites.
Yeah. So when I looked on my book, which is a evidence-based, or the evidence-based guide to herbs and supplements, there are about 50 things that came up as being relevant. And when we were talking the other day, some of the areas in which supplements may help include things like sugar cravings, insulin resistance, blood glucose control, and mitochondrial function. So I'll hand over to you to really get down in the nitty-gritty of what are the supplements that you, or what are the nutraceuticals that you use in your clinical practice, and perhaps give some examples of how you've used.
So one of my favourites is chromium. Chromium is a mineral found in the soil, but obviously in depleted soils you'll get smaller amounts. It has effects in carbohydrate and lipid metabolism. But one of the beautiful things about chromium is its ability to help regulate blood sugar levels, and also particularly for cravings. So where I love it is it reduces cravings. And for me personally, in my intern year, when I was at the end of the day after lunch, exhausted in my first rotation at the beginning of the year, there was a fundraising large caramello, koala and Freddo frog fundraiser across the desk, and every afternoon I just was like, I need sugar, and I was craving these massive chocolates full of sugar, and but I'd already experienced the benefits of being low carb and keto, so I didn't want to do it, but this craving was overwhelming me, and a alternative health practitioner actually recommended 500 micrograms of chromium. From that time that I started taking that, I never got that afternoon slump or craved that sugar again. And I'm not saying it's as easy as that for some people, because we know that the drive to eat sugar is powerful, and there's many things that influence that. But chromium, that's the star thing, I think, is reducing cravings. I also see it improving insulin in my diabetic patients. So the insulin, it's one of many things I use to help get insulin down.
Yeah. So a note on chromium, there's some people regard chromium as being highly toxic. There's two chemical forms of chromium. There's hexavalent chromium, very toxic, and trivalent chromium, which is what you buy in supplements, particularly chromium picolinate.
So I'm really talking about, for example, chromium picolinate. So there's actually really good safety data for supplements for chromium. The other one I love is myo-inositol. So one of the forms there's two forms of inositol found in the body. One is myo-inositol, and most supplements are myo-inositol. It's critical for cell membrane structure, but it actually, they found that raised glucose levels lowers myo-inositol in the cells, and so that you get a vicious cycle. Then you're eliminating it faster, but you have a need for it, and so it can be lower in diabetic patients. It regulates insulin levels. It's used in metabolic syndrome, and it's been shown in studies to help with insulin sensitivity. It also can reduce triglycerides and LDL cholesterol, and the doses are sort of 4 to 8 grams a day, but there have been studies showing that if you get over 12 grams a day, you might get some gastrointestinal side effects. I've never seen that. And one of the beautiful things about inositol is that it is actually needed for neurotransmitter production, and it's very calming. So if you've got a diabetic who's got metabolic syndrome, like they're overweight as well and they're stressed, and we are actually getting multiple effects from the inositol because it has a lovely calming anti-stress effect as well.
And this is one of the things that you reminded me of, that these nutrients often have more than one function. They're doing a handful of things. Yeah,
that's the beauty of it.
Yeah.
So another one that I love that I mentioned was cinnamon. So cinnamon has one of the highest antioxidant levels in sort of nutraceuticals and herbs. It's only second only to cloves. So that's one of its main mechanisms of action, is the antioxidant effects, because we know that in metabolic syndrome there's a high level of oxidative stress. So a lot of these nutraceuticals that we'll mention have antioxidant effects. So one of the things it does as well is helps with blood glucose control, and it also helps cravings. So I've recently had one of my patients who, along with doing daily intermittent fasting, 2 keto meals a day, doing some more prolonged fasts. So I'm also in favour of the prolonged fast. She got to a point where she'd lost about 30 kilos, but then she plateaued. And I actually used a cinnamon product that's high in cinnamon, but it has other nutraceuticals like myo-inositol and chromium in it. And just by adding that supplement alone, she got an extra 5 kilogram weight loss over 10 days. So, I mean, you've got to question, when we look at studies, is that person deficient and that's why it worked? But so I'm not saying that's going to happen for everybody, but it's in someone who's already doing the work. Sometimes these agents can just give a modest extra weight loss.
So you mentioned a combination product.
Yes.
That had chromium, inositol, cinnamon and trace elements.
Yes.
How easy is it to get those products?
Yes, so one of the difficulties is that good quality supplements, people aren't necessarily going to find them on the internet or walking into a supermarket or pharmacy. And this is where, there are trained professionals who are looking at literature on good quality supplements to make sure that people are getting high quality. So, in terms of dosing, getting the right dose, getting the right product, and also bearing in mind what other medications you might be on. So for example, someone who, if that lady wasn't diabetic, she had insulin resistance, so she wasn't actually, the lady that lost weight on that product, she wasn't actually a diabetic, but if she had been on medication, we would have had to be, taking extra precautions with her blood glucose in case that product, she was getting a rapid reduction in her insulin and glucose, which required less medication. So it's not the sort of thing that you should just pluck off the internet. You should see someone who's trained in nutritional medicine to get the right supplement. And I'm hoping that more and more doctors will want to, study in that area and learn about these things that can help markedly.
Yeah, and you mentioned a safety warning, particularly for cinnamon.
Yes.
Tell us about.
Yeah, so in Holland, I'm not sure if it's based on literature, but in Holland, where they eat a lot of cinnamon, they actually recommend that women who are trying for pregnancy or in the first trimester don't have high volumes of cinnamon. So I wouldn't use that in someone who was pregnant. But having said that, or someone who is trying, there have been studies with some of these products, including cinnamon, that have helped with polycystic ovarian syndrome. So in the lead up, it could be a helpful thing to do.
Yeah. And myo-inositol has been shown to help with PCOS.
Yes.
And it's extremely safe in high doses. Yeah. So you have a slide there about green tea and caffeine. Tell us about that. This could be good news for some people.
Yes, so to date, the studies, green tea has a lot less caffeine, obviously, than coffee, and most of the evidence has been around caffeine and type 2 diabetes. But what green tea also has, and caffeine has, are antioxidants. So, that you're getting that effect with oxidative stress. You're also getting what they have found is that for some people initially they can get a spike in their glucose, but overall you're getting a reduction in blood sugar and insulin resistance. My only caveat to that is that there's a molecule in our body called adenosine, which is a relaxing hormone that increases over the day. And we all have differences in how well we make adenosine and what is robbing us of adenosine. So for example, if you're very stressed, your adenosine levels might be lower, and caffeine blocks adenosine. So you've just got to be careful. Even people that say that they can have coffee at any time of the day have caffeine. Sleep studies show that it does still affect their sleep. So obviously we want these people sleeping really well. And for some people, I've had people, their anxiety left just by stopping caffeine. So it's for the right person who tolerates it well.
Yeah. Let's talk about magnesium.
Oh, magnesium, one of my favourites. Yes. So one of the things, in the past in nutritional medicine, diabetes was considered to be magnesium deficiency. And what's really interesting, magnesium, along with, other minerals like manganese and, there's a plethora of minerals, vitamin D, even though we consider it a hormone, these things are needed in glycolysis and the Krebs cycle. So if you have a look at the enzymes, which we often just get shown the biochemistry without all the enzymes and the cofactors that catalyse those, but each step has nutrients as cofactors. And so if you've got magnesium wasting from poor absorption, or medicines that affect the absorption, or credible stress, and you're chewing up your magnesium, you're an athlete, they have higher requirements, then you know, obviously supplementing will really help.
Yeah, my understanding is that something like 5 or 6 of the enzymes in the glycolysis pathway, there are, as I understand it, 9 enzymes in the glycolysis pathway. 5 or 6 of those are magnesium dependent. If you're depleted in magnesium, you're just not going to be able to process glucose. Also, people with diabetes who've got hypoglycemia tend to lose magnesium through their kidneys. So it gets to be a bit of a vicious cycle. You're depleted in magnesium, you can't process the glucose, your blood glucose goes up, which means you can't process the glucose. And as a clinician, I'm learning slowly to monitor serum magnesium, and that's one of the things that I commonly see in people who are late stage type 2 diabetes is low magnesium, and you're constantly trying to get their magnesium up to a decent level. Tell us about magnesium supplements.
Yeah, so just one point on the magnesium blood testing, because magnesium and calcium, for example, are so critical to have in the blood, because for cell membrane potentials they're so critical. The body will break down our bones if it needs to get it. So sometimes the blood values, I do see deficiency, and I see people on the bottom end of the range, but sometimes the total body magnesium isn't necessarily reflected in the blood test. But it's really important with magnesium to make sure you get the right type, and this is where doing a bit of training in nutritional medicine really helps, because, for example, magnesium oxide and to a lesser extent magnesium citrate and glycinate can stimulate your bowels, and that can be a good thing for some people. But for others, patients who already might be on other diabetic medications that can affect and cause a loose bowel, you want to make sure you always warn people and that you get them on the right type. So what I like are combination magnesium products with different types of magnesium. I wouldn't select out just magnesium oxide. Having said that, some people, their bowels are so sensitive that even the forms that are less likely, for example, magnesium orotate, to cause a loose bowel could do that in sensitive people. So you've just got to be constantly warning, because otherwise they'll get malnutrition from that as well.
Now we've heard from Dr. Matt Phillips this morning, the outstanding talk about the importance of excellent mitochondrial function he was talking about cancer and neurodegenerative disease. Our focus today is on metabolic syndrome. Talk to us about metabolic, or what supplements, nutraceuticals, you would use to support mito function.
Yes. So some of them we've already talked about. So magnesium, particularly forms of magnesium like magnesium orotate, but magnesium across the board, because it is needed, as we said, in glycolysis and also the Krebs cycle. It is a wonderful mitochondrial booster. The other one is alpha lipoic acid, which we haven't talked about. Alpha lipoic acid is made in our mitochondria, and in 1951 they discovered how important it was in the Krebs cycle. And so it's one that the beauty of it is that if you use some of these things like alpha lipoic and magnesium, people will often get an energy boost as well. So it's not just, so you're not just improving, biochemistry, you're improving their actual experience so that then they have the energy to do all these lifestyle changes that we're asking them to do.
Yep. We'll wrap up shortly. Are there any other nutraceuticals that you'd like to mention?
So probably the other one that I think is really important is vitamin D. So we've had a few people speaking over the weekend about vitamin D, but there have been studies showing improvements in diabetes with vitamin D in vitamin D deficient populations. So it's something to look out for in diabetes. We need good fats to have vitamin D. So we need good fats in our diet because it is based on a cholesterol molecule. But unfortunately in metabolic syndrome with obesity, obesity. People can sequester vitamin D into their fat tissue and then not be able to utilise that. So I think in metabolic syndrome it's particularly important, and if you want to know the mechanism, there are receptors on every cell of the body, so it's like, what doesn't it help with? And I think the important thing is not just with all of these things, because vitamin D is something that's useful to test and important to test because it is a fat soluble vitamin that can accumulate. It's just important that we make sure that we've got them well into the range. You don't want to be sitting on the bottom of the range with vitamin D. Now, obviously, it's one that we can get from sunlight exposure, but there are reasons why some people with lovely pigmented skin that stops you from absorbing as much vitamin D, people that can't get outside, people in nursing, elderly in nursing homes. So there's a lot of populations that cannot get skin exposure, and there are some people that even if they do, they have genetic polymorphisms where they can't make vitamin D. So it is an important one for supplementation.
Yeah, where I'm from, lots of public servants.
Cold weather.
Cold winters, cold wet winters, lots of vitamin D deficiency. Yeah. So I'm going to just summarise a couple of things. Think about the quality of the supplements. Not all products are equal. The scattergun approach may not be helpful. Having a multivitamin that's got a little bit of this and a little bit of that and a little bit of something else may not actually give you an adequate dose of what you really need. So the dose may be too small. But there's a series of questions that I think about, which is, am I eating a nutrient-dense diet? Do I eat organic foods grown in mineral-rich soils? Do I have robust digestion and absorption? Do I take medications that deplete nutrients or prevent their absorption? For example, proton pump inhibitors are well known to prevent absorption of magnesium, and one of the things that astounded me was ACE inhibitors actually deplete zinc. Am I stressed or depressed and churning through various minerals? Do I have a chronic disease that might mean that I have an increased need for particular nutraceuticals? Do I have genetic polymorphisms that might mean that I need more of a particular nutrient? Does the nutrient density of my diet match my activity levels, age, sex and reproductive needs? Am I drinking alcohol to excess or using recreational drugs? Am I exposed to environmental toxins? And if you can sort of answer, if everything's optimal, perhaps you don't need nutraceuticals. But the people that you and I see, often there's something that, in addition to a really excellent diet, that might help them move to the next step. Thank you very much for listening.